Thank you for joining us for today's webinar, The Echo Pandemic, Supporting Employee Mental Health in the Wake of COVID-19. Today, you will hear about AMO's partnership with Beacon and how the platform can support your organization in terms of enhancing mental health care outcomes. You will also hear from the town of Whitby about their experience implementing the Beacon platform. My name is Nick Reuter, and I'm a research advisor with AMO and LAS. As some of you might be aware, back in March, we launched our partnership with Beacon, a digital mental health care solution to provide municipal employers, their employees, families, and dependents access to quality and effective mental health care therapy. The Beacon approach is therapist-assisted, internet-based cognitive behavioral therapy delivered privately and securely through the Beacon digital platform on a connected personal device such as your smartphone, your tablets, or your desktop computer. AMO is pleased to be offering this digital solution to members, which aligns with the provincial mental health strategy on innovative ways to provide mental health therapy and create positive mental health outcomes. AMO has also negotiated a lower fee for this offering that Anthony will be speaking to shortly. And through aggregation, even smaller employers can take advantage of implementing Beacon for their municipality. We also walk the talk with our service offerings at AMO, and I'm pleased to say that we are also offering the Beacon solution to AMO employees as well. So we have two speakers joining us today. Anthony Sam is a business development director at Mind Beacon Group and is passionate about developing and supporting companies with their mental health strategies. Before joining Mind Beacon, Anthony was a change agent helping organizations build business cases for transformational changes within their benefits plans to optimize costs and support overall business strategies. Razul Kassam is a healthcare professional and NIDMAR certified disability management consultant. He has operated his own occupational therapy consulting firm, worked in the Employee Health Services Unit and Human Resources at the town of Whitby, and is the town's senior health, wellness, and attendance specialist. He has over 20 years of consulting experience within the fields of medical rehabilitation, health and wellness, and human resources, providing benefits analysis, mental health and wellness training, ergonomic training and programming, and claims management to facilitate early return to work programs and advising on all accessibility matters. So with that, I'll hand things over to Anthony.
Thank you very much, Nick. I appreciate it and the introduction there. And I'd also like to thank my colleague, Colin, that is with us, the Executive Vice President. He brings a significant amount of public sector experience and has been doing a lot of work with the Ontario government, which he will discuss later on. But I'd like to just thank everyone for taking the time, as well as AMO for partnering up with us, and also Nick and his team, and Rasul for taking time out of his busy day, because as we know, things change by the minutes, and even it's crazy how things have changed just from the first wave to the second wave. And there's a very much a growing concern or recognition that the level of mental well-being for our people relates directly to the success of organizations, and it can contribute meaningfully to our productivity, or even negatively to some of our highest controllable costs, which include things like turnover, disability management, and also drug claims. And over the few months, there's been a significant amount of change. And at some point, I felt that things were changing, by the hour. And obviously, due to the pandemic, workplaces have had to pivot really to support the employees. And many of your employees have continued to work through this pandemic, while some people had to, start working from home. And we've heard things like the next new norm or the new norm, and remote working has been part of the reality to some degree in every workplace. And that behavioral health has never been more important for employers to recognize that every individual has been impacted by this pandemic. And the reality of this is that we are all struggling to some degree with the implications from this worldwide pandemic that was cleared exactly 247 days ago. And naturally, we're searching, whether it be professionally or personally, we're searching for the way through, and that's the really the discussion today in terms of the echo pandemic and supporting your employees during this time. And I want to start off for a few minutes over here just to focus on the person that you see in the mirror every day, and take a few seconds and think about these questions of, how do I know if I'm coping well? Why is my body reacting, this way? How do I notice signs of stress in myself? And why can't I stop worrying about the future? And we're very fortunate as human beings that we have these built-in response systems. So take a minute and think about those questions. And these response system has been designed to deal with changes in our environment that identify as dangerous or threatening. And fortunately, our stress response systems, we don't need to turn it on. It's built right into us. And you think about the fight, the flight, and the freeze, those 3 Fs that we know about. The response is typically when we're dealing with that imminent danger, and your whole body needs to switch on. And we're naturally able to survive this type of threat. And the example that I'd like to use, if you live in a metropolitan city, maybe like Toronto downtown, and you hear that screeching noise of brakes, we know our body either freezes, we get ready to run, because we're preparing in case a car is coming our way. And it's a very important system to have, although something we don't want to use, too often. And then that new next norm, which includes multiple different stresses or threats. And, unfortunately, this new norm that many of us are adjusting to life with the COVID includes many different stresses or threats. And, at this time, more so than the first wave, there are still people dealing with things like self-isolation, the financial challenge, which we've heard, the mental health, the work-life balance, especially as everyone wants to enjoy, these last few weeks of these somewhat mild temperatures outdoors, whether it be, there are still those different types of scares out there, whether it be health scares, that information overload. And like I said, we're 247 days into this thing, and things haven't changed much. With the second wave, there are still stresses that are going on, not all life-threatening, but we are at risk of that overdrive that we think about. We first want to stop and check on what's, your own worry style of how much you've been planning for the future that is still a bit uncertain to a certain extent. And we're getting stuck into, are you getting stuck into those, those catastrophic thoughts about the worst case scenarios of all the time? And some of the data, which I think Colin will share later on, is just in terms of, what we saw from an anxiety point of view prior to COVID, and then how that's changed, and as well as depression. But one thing that it hasn't changed very much is that level of loneliness that people are very much reporting. So when we look at sensors, there are a few that I'd like to point out to you. And think about yourself and do a quick check on your own mental health to see if you have any of these stress overloads. And there are a few common signs. And I want to, they fall into 4 different categories. The first one being the cognitive, of the thinking. Do you have trouble focusing or concentrating? Are you consistently worrying? That difficult of making decisions? And then the anxiety, or the emotional side of anxiety. Are you irritable? Do you have that depressed feeling, or that feeling of hopelessness, or helplessness, or the inability to relax, or just be yourself for a little while? That physical symptoms of those muscle tensions, or those aches and pains, the fatigue, the low energy. Are you irritable? Do you feel the weight of the world is on your shoulders? And the last one is the behavioral, of the sleep, change in sleeping habits or eating patterns. Are you withdrawing from your friends or your family, or are you having difficulty completing tasks? And these reactions to the pandemic and related stresses will vary from person to person. It will really depend on how resilient you are, your support system, your worry style, how long you've been coping. And the best case is for you to, do a checkup on yourself to see how you're doing compared to how you're doing now compared to, how you were doing back in March and April. And the reason why I wanted to remind you to reflect and check on your own mental health is because many of you on this webinar today work in HR, and more often than not, you're responsible for the most valuable assets, and those are the employees of your organization. And these are just a few common signs. We can all respond in different ways to the pandemic. And take a few minutes to understand your stresses and also, perhaps your team stresses. When we think about, just a stat, and this came out from the US in particular, McKinsey and a company just a few months ago when I was talking to many different organizations. We spoke a lot about the relation to that 1 in 5 or the 20% of Canadians who are struggling with mental health issues. But this has changed, and I thought that I'd share these results with the survey, like I said, from McKinsey and Company. They surveyed about 1,000 employers, and many of these employers are concerned about their workforce's mental health. And 7 out of 10 of them are planning or already taken action. And 9 out of 10 are recognizing that this pandemic is affecting the behavioral health and productivity of the workforce in some shape, way, or form. And this is, this is because everyone's reality has changed. Most of us are dealing with the level of stress, which is impacted by performance and putting us at greater risk. And organizations are getting this, and as they prepare to move forward, are ensuring that whatever mental health programs are in place, that they're being viewed and reviewed to ensure that all employees have support, and that support while they're dealing with what for sure is, really uncertain right now. What we do know is that this cannot be ignored. This cannot be ignored, and we need and organizations need to take a little bit more action. Now, this pandemic, as we know, has been a worldwide crisis that caught many people, all of us off guard. And the impact is far from reaching in that in the beginning it was a public crisis, which evolved into an economic fallout. And now what is more difficult to address is the impact on mental health for millions of people in Canada, but also millions of people across the globe. And that trailing edge, or described by many as the echo pandemic, I've also heard that, the mental health pandemic will impact on our mental well-being. And I'm going to refer to this particular graph quite a bit in the next few minutes, because there's been a lot of research done over the years looking at aftermaths of disasters such as hurricanes, the floods, and one in particular, the Fort McMurray fires that took place in 2016. And it was really to understand the emotional reaction to the events that took place. Some of you may have read the Deloitte study back in August. And from the study, they referred a lot to the Fort McMurray fires as a case study. And I'm going to relate the Fort McMurray fires to this particular graph that you see, the mental health impact, and more importantly, connected back to the current pandemic that we are in. So this survey with the Fort McMurray fires, it was over about 90 weeks, where we saw that the Fort McMurray fires, the pre-disaster, this area over here to the honeymoon stage, lasted for about 18 weeks. And then 7 weeks was the disillusionment stage. But interesting, this was during the wildfires and evacuation. And during this time, it was recorded that about 92% of people visiting a physician for anxiety, it increased by about 92%, where people were visiting a physician for anxiety-related disorder was roughly about twice pre-disaster. So twice the pre-disaster and honeymoon stage. The Fort McMurray fires, in terms of the reconstruction, which is point number 6 over here, lasted about 65 weeks. And what they saw there was a 109% increase of people visiting a physician for anxiety-related disorders. And so again, this was about roughly twice the pre-disaster. Now, if you think about the pandemic or the COVID-19, the pre-disaster to the honeymoon stage lasted about 15 weeks. We first heard about this, back in November 2019, so almost a year ago. And although media only started reporting, cases around in December, and the World Health Organization declared COVID-19, the world pandemic, on March the 11th. Now, the disillusionment stage, which started pretty much on March the 11th till today, which is this side over here, we're still about 247 days into this, which is about 35 weeks and counting. And the reason for that is because we have no vaccine. Although the news reports in recent days from Pfizer, we have a little bit more light at the end of the tunnel. Now, I also want to bring a report in that Stats Canada drew from, which is in 2015, where what they said was 4.1 million people visited mental health professionals in 2015. Fort McMurray Pfizer, as I mentioned, reported visits increased by about 92%. So if we think about the absolute numbers, Canadians that will seek mental health medical professional during this pandemic, so the disillusionment stage, will range between 5.95 million to about 9.7 million. But keep in mind, we're still in this stage. Now, the reconstruction stage, which is when we find that eventually get that vaccine, it's predicted that we're going to see about 6.3 to 10.7 million annually people visiting a mental health, a physician for mental health conditions. So about 1/3 of the Canadian population. Now, it doesn't stop there. And the reason why is that reconstruction stage hasn't even begun. And because of that, no vaccine. And really, experts are predicting that it may last for 208 weeks or 4 years, or even 260 weeks, maybe 5 years. The point really over here for everyone listening, municipalities or organizations, is we need to plan now to ensure that you have those solutions in place for your employees. And if you don't, if they don't, there's going to be a tremendous, increase in a few areas of your business. First off, the absenteeism and the effect on your employees, and the short-term, long-term disability cost that is related directly to mental health. And then also your benefit plans of, you'll see increases of drug benefits. So the reason, for this, and as I mentioned, is we need to plan now. So when you're looking at planning, especially the mental health initiatives, which I'm sure many organizations have, is it's important to reevaluate them regularly, especially now that this is your opportunity to evaluate your mental health initiative at this time. And when we look at the Canadian numbers, it's estimated that about 40% of Canadian organizations have a mental health strategy. So we do have some work to do. And there are essentially 3 stages, which the first one is the baseline initiative, which is this area over here, or what we refer to as the foundation of mental health initiatives. And this is the minimum standard. And we need to build from there to the full implementation, which it shows that what needs to be in that area. And the standard of this standard, which includes all that is listed in the baseline initiative. And lastly, the integration and prevention. So here are a few things that you can work from. And evaluating each step is also extremely important for the organization. And you can do this by leveraging the data. As we know, that data, it tells us a lot about an organization, but also keep in mind that you'll only see the ROI that I know many senior leaders want to see, maybe 1 or even 1.5 years later. But it's important to really focus on this now, and be willing to, be willing to be open, hear that feedback, even though sometimes it's difficult to, you understand what employees are saying, or more importantly, accept what they are providing us with. And keep in mind, again, this is progress, and it's not perfection. We got to move forward and keep doing and improving the things that we have. Now, one of the things that I referred to a little bit earlier was in terms of the mental health strategy, leveraging drugs claims data as well as disability data. And I know Rasul will talk about this a little bit. And top drugs or DIN numbers, as we think about them, reports that they're very, I would say they're inadequate to a certain point to review the drug spending and numbers of claims that have been made by employees. And a few key things to note is, on average, depression drugs cost about $1 a day. So at this time, it's relatively inexpensive from that point of view. But we do know that mental health is costing organizations hundreds and thousands, if not millions in some cases. So mental health is a problem in most organizations. You need to go beyond the top drugs the top drugs list, or the DIN numbers, looking from a dollar point of view that you get from the carriers or your brokers. And you need to go to the transactional drug data. And you have the opportunity to help your employees to evaluate, the prevalence and severity of depression and anxiety within your plan member population. And you can use this data to plan your mental health initiatives. Now, one of the things that I've been looking at is, and it was reported, and I found this information from a company called Cubic Health, is what they've been reporting is that between 15 to 20% of plan members are taking prescription drugs that are related to mental health. So 1/5 of your population right now are using drugs for mental health. So we know that it is a challenge. Although, keep in mind that, obviously the cost of drugs, depression, particularly depression and anxiety drugs, have decreased because of, biosimilars and generic drugs. Therefore, you need to take a step further to dig deeper, take a deeper dive and review the number of claims. And one last point I want to make over here about antidepressants, when you see it on your DIN, on your top drugs, is that the DIN grouping, if you dig a little bit deeper, is that antidepressants can treat depression, anxiety, or nerve pain. So keep that in mind. And to lower the drugs over time, you need to be very proactive have proactive management from a mental health perspective and even a disability perspective. And, you really, really need to better understand the well-being. There's been claims that support that, by the fact that 75% of people prefer psychotherapy over medication, and the psychotherapy treatments are typically as effective as treatment for mental illness as pharmacological treatments. Taken together, these findings suggest that employees could achieve a greater ROI, if you prioritize investing in high impact areas such as leadership, education, awareness, prevention interventions, and that includes the psychological care benefits. And I want to leave you with this one last thought with this topic: is the cost of doing nothing will be astronomically more than the cost of doing something. And the last point I want to make before I hand it over to Nick and Rasul for the few questions is, what is needed now, regardless of organization, sector, size, is this business leaders to recognize the importance of the commitment to invest in mental health of the employees. And based on experience of Canadian companies, positive returns are not only possible, but well within reach when companies have meaningful and data-driven blueprints for investment tailored to their workplace and employee needs. You really need to build that solid foundation of workplace mental health, and steps have been taken to understand where attention is needed. Build on existing activities and monitor program outcomes. Combined with investments, the executive support organizations will then be on their way to reap the benefits of improving productivity and engagement that come with that mentally healthy workforce. So hopefully I've shared some insight over there regarding that, and I will turn it over to Nick to provide us more insight, as well as a conversation with Rasul and Colin.
Great, thanks, Anthony. So we've been seeing some questions coming in. I encourage people to keep submitting those questions through the Q&A box below, and I think we'll go right into the panel here with Rasul. So to start things off, Rasul, before implementing Beacon, what mental health programs did your employees have access to in the town of Whitby?
Well, thank you, Nick, for having me here first. To be honest, we really didn't have any mental health programs at the town of Whitby per se. We did have our EFAP program, and we had our extended healthcare programs with psychological benefits, but the utilization rates were really low just for various reasons. For EFAP, confidentiality was an issue. Our EFAP provider is really next door to us in Town Hall, and stigma for individuals going there, as well as cost prohibitive for our excellent healthcare benefits. So we really didn't have a mental health program per se, I would say.
Great, thanks. So most people participating on the webinar today probably have an EAP program for their employees, and you have both EAP and Beacon. Can you speak to the differences between the two programs?
Sure. In my perspective, EAP provides short-term solution-focused care for individuals either in stressful for life situations, work situations, financial situations. But again, it's short-term focused for a specific issue. And you maybe only probably get 5 to 6 sessions, and you don't even know if that human provider is going to be the same every visit. Where Beacon, what we found out is you go through a comprehensive assessment. It's cognitive behavior therapy. I'm a big fan of cognitive behavior therapy. I don't know if it's just my bias of doing cognitive behavior therapy prior into the past. But again, you go through a comprehensive assessment and you're provided with 8 to 10 weeks of solution-focused strategies that you can use with the same counselor. And even afterwards, you're provided with the same counselor. So the continuum of care is there, right? So that's where I see the major differences between the two.
And just following up to that, would you ever consider just having Beacon or just an EAP?
I actually liked having both, to be honest, right? Beacon was really handy in the beginning of the pandemic because of everything shutting down. We really couldn't go see our EAP provider or even our psychological providers because virtual care, some of them, it just was not possible. So we had Beacon at that point in time and the uptake was great. What we're finding now is that individuals can use EAP for that short-term solutions as well as Beacon in terms of providing their holistic strategies for going forward in their mental health, right? So.
Thanks. And can you speak a bit about virtual healthcare providers and the difference between those options and Beacon?
Yeah, so I mean, prior to signing on with Beacon, we did a little bit of research with different virtual healthcare providers, and what we found is that some of the services they offered was a range of services, and there's a lot of free virtual healthcare out there, and we provided that information to our employees. The feedback that we got back was that they didn't know if it was confidential, where that information was going, as well as just the continuity of care, right, going forward, as well as if there was any type of mental health services that were free. They were just more generally specific in terms of the information they provided. So it wasn't geared to an individualized treatment program. And if you wanted that option, what we found is that the cost for that option was 2 to 3 times more than Beacon.
So why would a municipality purchase Beacon services that are available for free for all Ontarians?
Yeah, so again, first what I would say again, I believe because of cognitive behavior therapy, and which I'm a big fan of, is you're getting that individual care for that employee, right? So from an employee perspective, you're getting that one-on-one support virtually, and it's continuum of care. Secondly, we get quarterly performance reports from Beacon. And what that has done is provided us great information on what is happening right now for our employees that are using or going through the program. Prior to Beacon, we used our lost time data, we used our drug information data, and we knew that mental health cases, disability cases, compensation cases were on the rise. But at the time, it would be about 34% of all lost time was mental health. But we didn't know exactly what mental health issues were related to. When we get our lost time, when we get the performance data back from Beacon, we actually found out that because of COVID, generalized anxiety is actually tops depression. So now what we're able to do is take that information and gear our wellness programs and wellness initiatives towards the specific data that we're seeing to provide more care for our employees.
Thanks. So the next question is for Colin Anderson, who's also joined us on the webinar today. And Colin's been participating in previous AMO Beacon webinars in the past. How many Ontarians have made use of the free Beacon program, and can you share any data or insights on that program?
Sure, and hi everybody. And I have a long-standing history with AMO, because prior to being a Beacon, I was a deputy minister of finance with Ontario. So dealt with a lot of the uploads and the downloads that some of you would recall from past days. So nice to be here. And just before I answer that question, I just wanted to echo some of the things that that Rasul had said. You know, I like to think of us as mental health PPE. So as municipal employers, you're all familiar with the concept of personal protective equipment for people on the physical side of the equation. Think of us as mental health PPE, earlier intervention. So before somebody actually needs their EAP program, you can put this into place. And what we have seen with a number of our employer contracts is the Beacon basically pays for itself in reduced absenteeism, and then you get all of the other benefits that Anthony and Rasul were talking about with regards to prescription claims and things like that. And so you do get that. People see it because we are an arm's length provider. That stigma issue that can be there. You know, they don't have to give their work email. They may, sometimes people are worried about HR department finding out about it. Some people aren't actually comfortable giving their information to a government website. So they want to make sure that you want to make sure that they've got services available to them in a variety of different ways and places. And then you get the information that goes along with it. And you get a communication campaign throughout the year that you can tie into your own wellness initiatives. Like if you do Bell Let's Talk or something like that, we can help with those kind of things. So yeah, with the Ontario program, you know, it's essentially the largest ICBT program in Canadian history, actually. And what we're finding is that it is tied to COVID. So hopefully it won't be around forever necessarily. We'll see how long COVID lasts. And we are seeing that we are getting equivalent results to face-to-face treatment, whether it's video or in person, and also first-line treatments like medication. And we've got the data to prove it because we use clinically validated outcome measures. So we've actually, this week, we got our 6,500th person into treatment. As Rasul said, we've seen more broadly very similar experience. Depression used to be the #1 presenting issue, and now anxiety is. And that pretty much became the situation in February and March. We could just see it ticking up. And it's held that way. And what our senior clinical people will tell us is the longer anxiety lasts, more likely it could turn into depression issues as well. So we're monitoring that to see how it goes. Our top 3 protocols now are anxiety, depression, and PTSD. And we're the only ones that can deal with PTSD. We've had results that are equivalent to face-to-face treatment across all of our protocols, across all age groups. So this is not just for young people. Sometimes people think it's an online therapy, but actually most of our folks are well over their 30s in the average. We have people in their 70s who are using it as well. All genders, all symptom severities. So this isn't just for mild and moderate cases. We are effectively treating people who are in the severe category as well. You know, Rasul mentioned that it's a very personalized treatment. So some other providers that are out there, they assign a set of modules when you're on their depression protocol. What we do, and because we have a rich legacy in cognitive behavioral therapy with our clinics, is we are able, with the one-on-one therapist, to customize and personalize your treatment from the start through to the finish. So we do the rigorous assessment we assign you a protocol based on your primary problem, but then it's very common for us to bring in content from another protocol. So, for example, 90% of the people who are on our depression protocol, our therapists are providing anxiety content, insomnia content, a variety of things. So it's personalized all the way along. And so these are important things that contribute to symptom reduction and the results that we've been getting. And we've been very transparent about our results. You can go on our website and see them. So and this, it's important to stress that this is for employees, but also for their family members as well, is an important feature of this.
Thanks, Colin. Just to follow up that question, is there an end date to the Free Ontario program?
No, I mean, that's, Anthony showed the phases diagram. Prior to COVID, we were already working in the Whitby area with the colleges and universities there on a program for post-secondary students. And then COVID came along, and it's, we're just going to have to see how long it applies. I think there's no end date at the moment. We'll just have to see how things are going with regards to, even some of the initiatives that the Premier and others may be talking about today. One other thing I just wanted to mention in a municipal context that we have found is an important differentiator is that this program, because it's available 24/7, it's very attractive to people who work shifts and can't control their own schedule. It could be, I saw one of the questions in the chat, about people living alone or who are at home. This is something that they can do wherever they're comfortable and whenever they're comfortable. And so they might not have a schedule or shifts that allow them to do video appointments during the regular video appointment hours of 9 a.m. to 9 p.m. or something like that. This is the kind of service and support that they can get, that they can use any time of day that they want to. And I think that's an important feature for people to understand as well.
Thanks, Colin. The next couple questions are going to be back to you, Razul. Can you speak to the overall employee experience of using the Beacon platform at the town?
Sure. We started Beacon in May, and at that time we had 31 individuals go through the program. And what we found was that 75% of those individuals were in the moderate to severe symptoms, and after going through the program, 81% of employees reported subclinical or mild symptoms after completing Beacon, and 94% of those experienced an improvement in their overall mental health. Some of the data that we got back from Beacon indicated that 86% of employees were very satisfied or satisfied with their overall experience. 93% were very satisfied or satisfied with the support they received from a Beacon therapist. Some of the comments that we got from individuals going through the program said that I value the takeaways I've learned so far, things I can action in my life that are helpful. The check-ins were helpful and with accountability and keeping me on track. I appreciate the tools to assist in my recovery. And another individual also indicated that the new skills learned can be applied right away. So all this information leads me to feel that the overall experience of our employees has been really great with Beacon.
Nick, there was one other thing when you were asking the question about programs free, while it's free for all Ontarians. I think people would be interested to know that the Ontario government itself, after the start of the OTN program or the Ontario program, introduced a program for correctional workers because of the targeted communication, because of the data and information reports that Razul was talking about, and how they can feed that back into their individual wellness programs. And then we've had others like Hydro Ottawa just launched a few weeks ago. So there are definitely people who they're not waiting for the the COVID program to be over. They're getting on top of things right now and integrating it into their own wellness programs quite effectively.
Thanks, Colin. Razul, the next question is in regards to the senior leadership at the town. What and how were you able to show the value of Beacon to your leadership team, and who were the champions, and how did it all come together for implementation?
Sure. So prior to Beacon, we were actually lucky that we took a lot of our lost time data, our drug benefit data, and claims, put them all together. Exactly, was coming is about 30%, 34 or 35% of our lost times mental health, and when we costed it out, is about $110,000 of actually cost that was spent for treatment, as well as about $264,000 in lost time that we found out. And despite having our excellent healthcare benefits, despite having EAP, the trend wasn't going down. And so our champion was actually our director of organizational effectiveness came to me and said, there's Beacon, can you look into this? And we were actually lucky. If there was a silver lining in the pandemic, it was that we didn't really have to go through the normal processes of having an RFP and going through all the different treatment providers. But we did the research and we brought this to our senior leadership team. We brought it to our CAO. And after having the discussion, we just felt that at that time, it was the right thing to do for our individuals. So our champions are really our senior leadership team and our CAO to provide this service to our employees, right? Going forward.
Great, thanks. Next question, how is Beacon going to help the town of Whitby employees over the long term?
So again, what we found is just there's been a cultural shift in terms of using this app and using Beacon. Right now, the cultural shift is, before there used to be a lot of stigma with regards to mental health. A lot of our people leaders are now promoting Beacon to our employees with any type of issues, future wellness plans together. So again, the data showed that generalized anxiety was up on mind and top of mind right now. So we're dealing with that and providing support and services as well as programs right now for generalized anxiety during the pandemic. So we're going to use the data to help go forward with our future wellness plans at the town.
Great, thanks. And that kind of dovetails nicely into the next question on reporting. How are you using the reporting that Beacon provides you?
So prior to COVID, we were lucky that we took a lot of our lost time data and extended health benefit data, such as treatment and drug information. And what was providing us was that mental health illness was a huge issue for us. And what we've seen now is, in terms of looking at Beacon, that our mental health claims are down from 60 days on average to actually 30 days on average. And individuals actually come to me who've actually used Beacon have indicated that they've greatly benefited from Beacon. And what we've seen is that, again, our lost time data is down. What we're also using is the reporting structure is to frame our wellness initiatives going forward. Again, the reporting came back indicating that generalized anxiety was a huge factor for employees at the town of Whitby. So now what we're doing is gearing some of our wellness initiatives towards anxiety.
I did see there was a question in the Q&A about confidentiality, and I just wanted to make sure that people understand that we don't provide any individual personal health information to the employers. We are very strict about complying with PHIPAA and the like, and so the information that we send back and the reporting that goes back to the employers is de-identified, it's aggregated. If the sample size is smaller than 20, we don't provide information. And that was one of the points that Nick made at the beginning about, you know, aggregating some groups together so that they can get reporting that is still insightful and useful without having their employees having to worry about their own individual information going anywhere beyond us.
So another question for you, Razul. In the past, you mentioned that you would direct employees to CAMH for an assessment. And each time that happens, it would cost about $5,000. How many did you refer to CAMH in 2019? And since adding Beacon back in May, have you had to send employees to CAMH for further assessments?
In the past, we sent 5 individuals to CAMH and other independent medical examinations. But because of Beacon, we actually have not, since we've implemented Beacon, we have not sent anyone for an independent medical examination since then.
And that's a fairly expensive process as well, right? To send them. I don't remember the cost of some of that, but it can be quite something. 2,000 to 5,000, I think, is what I maybe heard in that. So it is quite something. Yeah.
So we have a question from the floor. At the town of Whitby, what statistics were used to measure the state of the organization before and after MindBeacon was implemented?
Anyone can hear me, but again, we used a number of statistics. We used our lost time data, we used absenteeism. We also used our drug benefit information utilization for EAP. We put all that information together, see exactly where we were at that time.
I actually had one comment I just wanted to make, because, you know, sometimes we get the question of, our extended health benefits cover some of these kind of services. Why should we use this? And I think what's important to note is that there's a significant difference in uptake for these kind of services when people don't have to go through the paywall step. You know, they're struggling already. They may not have room on their credit card. And for them to lay out money and then have it paid and reimbursed, even if it's 100% reimbursed, we've seen a 10 times difference in uptake. So if the goal, as it should be, is for people to use these services and make it easier for them to use it, you know, these kind of programs where the employer is offering it directly has that individual benefit as well as the organizational benefit.
Thanks, Colin. Actually, I have a couple of questions that we can dive into while we're waiting for some more from participants. Can a member access the program through their existing benefits plan provider? Maybe Colin, you could answer that.
Yeah, and that's actually what it is. I hadn't seen that question, but yeah, sure they can. Like I said before, you know, there are people who are uncomfortable using a government website. They may be. Some people want to use their benefits for other things, so it sort of depends on the amount of room that they have available in their benefit plan. In general, if you were to go see a psychologist face to face, it would cost you $3,000 or so, and most people don't have that amount of benefits. Now, some people prefer to use their benefits because they don't want to go through their EAP program, or you want people to use whatever inroad they're comfortable with. So, and then like I just said, the disadvantage of using benefits is that they do have to, in many cases, put out some money up front and then have it reimbursed, and there are steps involved in that. But some people do opt for that option.
Thanks. Maybe Anthony, you can answer this question. Can you go into a bit of detail on how a municipality can go about enrolling in the Beacon program?
Yeah, sure. You can, a couple ways is you can connect directly with me, or else you can go through Nick. And the process normally takes, once we have gone through, the paperwork contract, we just need to understand your population, your employees, more importantly, the employee count. And then there's a few questionnaires that we do provide. And normally the launch takes about 2 weeks. So from the time we get the okay from the organization, then we can launch within 2 weeks. And the cost right now, because we have the agreement with AMO, it's $3 per person per month, per employee per month, and that also includes their families. And that what that includes is also all marketing material and the communication that we do provide the organization, the municipality, that we can customize to their particular needs. So $3 per person per month for the employees as well as the families. And if you want to talk a little bit more about it, feel free to reach out, and I'll put our information up in a few minutes.
I think that kind of answers the next question that just came onto our screen about how does the contract work? Does the town of Whitby pay a flat monthly fee for access for all staff? Are dependents also able to access Beacon, or are they referred to the free provincial program? I'm not sure, Colin, if you have any remarks you want to provide.
Yeah, well, I think I just want to underscore what we're seeing across the country with everybody that we're working with, and that this idea of mental health protective equipment, PPE, the graph that Anthony showed about the phases, what phase are we in of that? Are we into wave 2, and how long is this going to last? And we know from SARS and 9/11 that the psychological impacts are going to last for 36 months. And another unfortunate statistic is that for every 1% increase in unemployment, there's generally speaking a 1.5% increase in suicides that follow. And 1 in 5 Canadians before COVID were struggling with a mental health issue. It's more like 1 in 3 now. And everybody knows somebody that is impacted economically. Maybe they've a friend or a colleague who's lost their job, or a family member or something like that. And so making these services available to as many people as possible in as many settings as possible is really what we set out to create a product that was going to be affordable and accessible and overcome the stigma. My own father was bipolar. My mother has an anxiety disorder. That's why I got into this business after having been working for the province of Ontario. And we are trying to make this service available in as many places as possible and make it as easy for people to use it and when they see the need for it. And I guess the last thing I would say is, people don't always use a service the first time they hear about it. And yes, there's an Ontario program that's available, but they may not even be aware that that's available. And so, and Uzul would probably concur that having a program where you can integrate it into the communications for your employees, just to remind them once a month, every couple of weeks, that the service is there. Maybe it's the 5th or 6th time, and they hear about it and they go, okay, I need to do something about this, and this service is available, and I appreciate that my employer has made it easy for me to find it. So I think that's another thing to keep in mind. This isn't by any means a one and done kind of thing. You need to, and we work with you to identify, champions in the organization who can, and how managers can talk to people who may be struggling. There's all kinds of tips and tools that we can provide to integrate into your particular environments to make sure that the outreach is happening. So, from the human perspective, I think that's an important feature.
Thanks, Colin. A few more questions have come in. Maybe Anthony, you can answer this one, going back to the previous question from Brittany here. How does the contract work? Does the town of Whitby pay a flat monthly fee for access for all staff? Are dependents also able to access Beacon, or are they referred to the free provincial program?
Great. Okay. Yeah. Happy to answer that again. So the contract is directly with Beacon, and they do pay a flat fee per employee per month and that includes the dependents. And in terms of the amount, like I said, it's $3 per person, per employee per month. And obviously, with if depending on how big your organization is, we can negotiate that particular price. And then what comes with that is all the marketing material that is customized to the organization and all the reporting that Rasul has mentioned.
Thanks. Two more questions here. Is the cost based on usage rate or overall employee population?
Yeah, that's an excellent question. So it is based on the amount of employees that you have at the organization. But at the same time, we are looking at a different, one more way of assisting municipalities. So if you are interested in learning more about that, please reach out to me and we can definitely discuss that in a bit more detail. But it is per employee per month, so the amount of employees within the organization.
Thanks. And just one final question before we close things up. If our municipality decides not to join, can individuals sign up for the service?
Yeah, that's also a great question. So if you're in Ontario, there is that free program that Colin mentioned, and we've had just over, Colin, I think it's 6,500 people. Reach out to us. We have the information that we can send to you. If you're not in Ontario, you can definitely go through your EHC program, or else you can go directly onto our website, and you can sign up through our website as an individual.
Great. Thanks, Anthony. So seeing that we're running out of time, I will I'll wrap things up. Again, if members are interested in the Beacon platform and how it can help your municipality, please reach out to Anthony, and his contact information is there on the screen, and he'll be happy to discuss how Beacon can be implemented in your municipality. So that concludes our webinar. As I mentioned, we will be posting it on the AMO YouTube channel. If you've enjoyed what you've heard today, please click subscribe to receive the latest updates on the activities of the association, as well as past AMO webinars and updates from your AMO president on the work of the board of directors. So thanks again to Colin, to Anthony, and to Rasul for joining us today and providing all that information. And thank you to all of you for participating and listening today to the webinar. So with that, take care and be well. Thank you, everyone.